Typically, it would be processed food, so anything easy, packaged, has a lot of sugar, a lot of salt, a lot of carbohydrates, like classic, morning of cereals and cinnamon buns and, cookies and cakes and just immediate sugars that are available to the body.
Welcome to episode 2 of A Heart Health Carolina. That was Dr. James from the end of last episode, talking about what a typical American diet looks like today.
And certainly not a lot of vegetables and fruits, because I remember college and I don't remember eating vegetables and fruits in college.
Does that sound pretty right to you? When freshmen make the transition from living at home, where someone else typically buys groceries and cooks meals for them, to a busy campus full of easy and fast options, those healthy choices get a little harder to make, even if finding them might not be as hard as it was 10 years ago.
I think today more kids are eating healthier. I think that's a big movement in our country.
Like my mom said, there are more healthy options now, but it's a matter of consciously choosing to create a healthy lifestyle that can be a problem, as Dr. Turner stresses.
We see a lot of habits stick with people. So the college time is sort of your first time away. It's where you're really breaking free of what your parents were feeding you, and you're developing your own tastes and habits, and that's really a time of vulnerability. So you're either going to develop tastes and habits for unhealthy foods or healthy foods.
But I get it. When time is limited and there are so many distracting and yummy options available, it's hard to make the healthy choice. Even the dietitian at UofSC, Juliana, recognizes this when working with patients.
You have the ability here at Russell House. You can absolutely go to Chick-fil-A every day, or you can also go to Southern Kitchen, Panera, Chick-fil-A sometimes. So it's kind of navigating that freedom that you get at college, knowing that it's okay in moderation, but finding out what moderation is for you.
This is why UofSC hires people like Tanya, the dietitian for Aramark, UofSC's food provider, who creates the educational posters you may have noticed the last time you stopped by Russell House. So Tanya, what's the first step in creating your healthy eating roadmap?
So what I think of most is My Plate. I don't know if you've heard of that before, but it's kind of it replaced the food pyramid. So it just goes over how you can make every plate, kind of healthier, and kind of what food groups to look at. And so I'm, a huge, and a fan of, looking at all the food groups in general, and so not cutting out a specific one just because there is possibility of, missing out on nutrients.
Tara's roadmap helps guide students through making more balanced choices at the restaurants they frequent. If you're saying that everyone needs a protein and a carb, I know a lot of kids that will count Chicken Finger Wednesday. Well, I'm eating chicken fingers, there's my protein. What do you say about that?
Well, I say it's a step up than just eating 5 donuts. However, I would like it not to be fried. I mean, I think you need to look at the things that can potentially increase cholesterol. And fried foods are definitely a type of food that will elevate cholesterol levels.
So, keep your Chicken Finger Wednesday, but maybe just keep it to Wednesday. And then on a few days out of the rest of the week, Dr. Turner recommends trying to cut out animal proteins altogether.
Cholesterol is found in the muscle of animals, so chicken is still high in cholesterol even if you remove the skin off of it, because it's in that protein muscle. So I really try to emphasize plant-based proteins for college students because they're cheaper, they're going to give them fiber and phytonutrients they're not getting, and to really find ways to learn to love them and incorporate them into their diet.
The practice of removing foods created from animal byproduct and increasing other nutrients falls right in line with another lifestyle diet Juliana sometimes recommends.
Cardiovascular disease, I know there's the DASH diet, so it's a lot more fruits and vegetables than the typical American might eat.
I haven't heard of that. What is that?
Yeah, dietary approaches to stop hypertension. So that
DASH.
is the one. Yep, DASH for hypertension. But the DASH diet, it's pretty tailored as far as it tells you basically how many food groups you need throughout the day, and then we can kind of talk about how that can best fit your schedule. So basically we would limit your sodium, we would limit your saturated fat, but we're significantly increasing magnesium, potassium, and calcium.
And if you haven't picked up on it yet, your biggest takeaway when it comes to eating for a healthy heart is...
This is not about calories. This is far more about how do each food group work off of each other to like stabilize your blood sugar. So it's kind of like making sure that you've reached all your nutrients with that goal in mind.
And the best option is to always do it yourself.
I've been conducting nutrition interventions for 2 decades now, and I've noticed we always do sort of hands-on cooking classes, and I've noticed over the years that more and more we have to teach lots of cooking skills that we didn't have to a long time ago. People are losing the ability to cook. And so if you're relying on takeout, fast food, frozen dinners, that's just going to be, foods that aren't as healthy for you.
Next episode?
I just, people think, I eat so well, and that's terrific. But if you're stagnant, that means you sit, 10, 12, 14 hours a day, and you're not moving your body. That's a great disservice.
That's right. As Dr. James mentioned, you need to get up and move. Strom Thurmond personal trainer Jordan has a few tips.
The reason it was 10 is because that's kind of what they think you need for heart benefits.
More next time. Thanks for listening. Forever to thee, Carolina.